Welcome to Silver Vitality Vault, your premier destination for evidence-based health advocacy and longevity strategies tailored specifically for the modern senior. They often call them routine checkups, but for women navigating their 70s and beyond, some of these standard medical tests could actually be doing significantly more harm than good. You have been told your entire life that prevention is key, and that more frequent screenings automatically equate to a longer, healthier life. However, behind the sterile walls of the clinic and the reassuring smiles of the staff lies a billion-dollar medical industrial complex quietly pushing unnecessary procedures that carry grave, hidden risks. We are talking about unnecessary radiation exposure, the psychological trauma of false positives, the cascade of overdiagnosis, and the physical toll of invasive treatments for conditions that were never going to cause you harm in the first place. This is the part of the story that most older women never get to hear. Instead, many are pulled into an exhausting cycle of diagnostic tests and repeat procedures, while pharmaceutical giants and insurance corporations continue to thrive on the revenue generated. In this deep dive presentation at Silver Vitality Vault, we are pulling back the curtain on the 5 health checkups that older women should never agree to without asking rigorous, serious questions. We have ranked these from least to most dangerous, leading up to a procedure still pushed in almost every hospital today that could actually double your risk of cognitive decline. Before we begin, I want to ask you, have you ever left a routine test feeling physically worse or more anxious than when you walked in? Are you ready to see what the latest peer-reviewed research says about what you actually need to stay healthy after 70? Drop your thoughts in the comments below. We read and reply to every single member of our community. Now let us begin with number 5. Number 5, the misleading metric, bone density scans, DEXA. At number 5 on our list, we find the bone density scan, commonly known as the DEXA scan. In routine geriatric care, these are often ordered as a matter of course to detect osteoporosis. While the goal of preventing fractures is noble, the application of this test to women in their 70s is fraught with complications that your physician might not have mentioned. By the time a woman reaches 70, her bones will naturally show signs of density loss. This is a physiological reality of aging, not necessarily a disease state. However, the DEXA scan uses what is known as a T-score, which compares your 70-year-old bones to the peak bone mass of a healthy 30-year-old. Imagine comparing the elasticity of a senior's skin to that of a teenager and labeling the difference a medical emergency. That is precisely the logic at play here. A 2015 report in JAMA Internal Medicine revealed that over 60% of women over 70 diagnosed with osteopenia, a very mild and often harmless form of bone loss, were prescribed aggressive medications like bisphosphonates. These drugs carry a litany of severe side effects, including spontaneous thigh fractures, jawbone decay, osteonecrosis, and debilitating esophageal ulcers. Most of these women were never at a statistically significant risk of a fracture to begin with. The Silver Vitality Vault Professional Protocol. If you are over 70 with no history of broken bones or sudden height loss, you may want to skip the routine scan. Instead, ask for a FRAX assessment, which calculates your real-world fracture risk based on lifestyle, history, and balance. I remember Margaret, a 74-year-old gardener who joined the Silver Vitality Vault community after a DEXA scan led to a prescription that gave her severe esophageal damage. We found that her lifestyle, walking, calcium-rich nutrition, and sunshine, was already protective. After stopping the unnecessary meds and focusing on gentle resistance training, which research shows can improve bone density by 6% without drugs, she is thriving once again. Number 4, the hidden strain, routine blood panels, and kidney overlook. Number 4 involves the annual blood panels that most seniors consider the gold standard of health monitoring. While checking cholesterol and blood sugar is important, these standard tests often hide dangerous, developing kidney damage in older women. The primary marker used in these tests is serum creatinine, a waste product your kidneys are supposed to filter. However, creatinine levels are directly tied to muscle mass. Because many women over 70 experience natural muscle loss, their creatinine levels might look perfectly normal. even if their kidney function is in a dangerous tailspin. A 2022 study found that these standard tests missed early-stage kidney disease in over 35% of women over 70. This false sense of security is where the real danger lies. If a doctor believes your kidneys are healthy based on a faulty test, they might prescribe medications, like NSAIDs for arthritis or certain blood pressure meds, that are actually toxic to fragile kidneys, pushing you into rapid renal decline. The Silver Vitality Vault Professional Protocol. If you are over 70, especially if you have a smaller frame, you must ask your doctor for a cystatin C test. This is a far more accurate marker of kidney health that is not affected by your age or muscle mass. The National Kidney Foundation has recommended this for elderly patients since 2021, yet many clinics still rely on the outdated creatinine check. This was the case for Donna, a 76-year-old teacher who felt exhausted and had swollen ankles despite normal blood work. Once we ran a cystatin C test, we discovered stage 3B kidney disease. By adjusting her medications and focusing on hydration, we stabilized her function and returned her energy levels to normal. Number 3, the cognitive collision, CT angiograms. As we move to number 3, we enter the territory of heart health. The CT angiogram is frequently recommended for seniors to rule out coronary artery disease. It uses a sophisticated scan combined with a powerful contrast dye to map the blood vessels of your heart. But for a woman over 70, this dye can be a silent assassin for both the kidneys and the brain. First, the dye puts an immense strain on the kidneys to filter it out. If your kidneys are already secretly struggling, as we discussed in the previous point, this scan can cause acute kidney damage. But even more shocking is a 2021 study published in Stroke, which found that older adults who underwent multiple contrast dye scans had nearly double the risk of developing vascular dementia. The dye can alter blood flow or trigger microscopic clots in the fragile vessels of the aging brain. The damage isn't always immediate. It often manifests months later as confusion, forgetfulness, or mood swings, and most patients never connect it back to the heart scan they had earlier that year. The Silver Vitality Vault Professional Protocol. Unless you are experiencing unstable angina or fainting spells, there are much safer ways to check your heart. A treadmill stress test combined with an ECG can often give the same answers without any contrast dye at all. Another excellent low-risk option is a coronary calcium score, which uses a very low dose of radiation and no dye to measure plaque buildup. We worked with Teresa, 79, who began suffering from memory lapses after repeated CT angiograms. By switching her to a blood pressure medication that improves brain perfusion and avoiding further dye exposure, we were able to help her recover some of her cognitive function. Number 2, the Anxiety Architect, routine pelvic exams. Number 2 is a test that is still pushed in almost every hospital, despite the U.S. Preventive Services Task Force stating there is no evidence it saves lives in asymptomatic women over 70. We are talking about the routine manual pelvic exam. For older women, these exams frequently lead to false positives. Because of age-related changes, a doctor might feel a small cyst or growth that is perfectly benign. However, once that discovery is made, it triggers a medical cascade: more ultrasounds, more biopsies, and often unnecessary surgeries. These procedures carry high risks of infection and slow healing for seniors. A study in the Archives of Internal Medicine found that 63% of women over 65 who had these routine exams ended up in a cycle of follow-up tests that ultimately revealed nothing dangerous. These incidentalomas, small growths that would never have caused symptoms, become a source of lifelong anxiety and unnecessary surgical trauma. The Silver Vitality Vault Professional Protocol. If you feel perfectly fine and have no pain or abnormal bleeding, the risks of a manual pelvic exam often outweigh the benefits after 70. Eleanor, a 75-year-old chef, underwent a surgery for a harmless fluid-filled cyst found during a routine exam. She suffered complications and a long recovery for a condition that was never a threat. At Silver Vitality Vault, we recommend a symptom-guided approach. If you have no complaints, you can often safely skip the manual exam. If an issue is suspected, a non-invasive transvaginal ultrasound is a much more precise and less risky way to get an answer. Number 1, the gut and brain disruptor, colonoscopies. Finally, we reach the number one test that seniors should approach with extreme caution: the colonoscopy. While it is touted as the gold standard for cancer prevention, by the time you reach 70 or 80, the prep and the procedure itself can be more dangerous than the cancer it is trying to find. The colonoscopy prep involves a powerful laxative that completely flushes the digestive system. In older women, this leads to rapid dehydration, electrolyte imbalances, and dangerous drops in blood pressure. But the long-term damage happens in the gut microbiome. The prep flushes out the trillions of beneficial bacteria that support your immune system and your brain. A 2019 report found a 12-fold increase in the risk of sepsis, a life-threatening infection, in the 10 days following a colonoscopy in seniors. Furthermore, the anesthesia used during the procedure is linked to short-term delirium and long-term cognitive decline in older adults. A 2020 study showed that 41% of seniors experienced measurable memory changes after outpatient anesthesia that lasted for at least a month. The Silver Vitality Vault Professional Protocol. If you have had clear colonoscopies in the past and are not experiencing rectal bleeding or unexplained anemia, many major guidelines recommend stopping routine screenings after age 75. There are far safer, non-invasive alternatives like Cologuard or FIT stool tests that you can do in the privacy of your own home. These have high detection rates with zero risk of dehydration, sepsis, or memory loss. We saw this with Joan, an 81-year-old piano teacher who was pushed into an unnecessary colonoscopy. The procedure led to sepsis and a stay in the ICU, and her family noticed her memory was never the same afterward. Don't let a routine test steal your quality of life. The Silver Vitality Vault Promise. The most powerful medicine in the world isn't found in a machine or a diagnostic lab. It is found in personalized care based on your specific symptoms, your history, and your values. At Silver Vitality Vault, we believe that every woman over 70 deserves to be the CEO of her own health. These 5 tests, bone density scans, routine blood panels, CT angiograms, pelvic exams, and colonoscopies, all have their place, but they must be used with wisdom, not just because they are on a routine checklist. We want to hear from you. Have you or a loved one ever regretted a routine procedure that caused more trouble than it was worth? What is one health decision you are proud of questioning? Please share your story in the comments. Your wisdom could be the very thing that saves another woman's life today. If you found this guide helpful, please hit that like button, subscribe to Silver Vitality Vault, and share this video with the women in your life. Knowledge is the key to vitality, and we are honored to provide it to you. Thank you for watching. Stay empowered, and we will see you in the next video.